I'm Kelsey Coker, the director of this documentary. Throughout my life, I have been fighting a disease. Cystic fibrosis is a disease that me and about 30,000 other Americans carry throughout their lives. Each day comes with its challenges with health problems, wondering when the next time we'll be in the hospital, or if people will accept me for who I am. Throughout this documentary, you will meet many people who have been affected with this disease in different ways. My sister Kelsey, a 21-year-old who also has cystic fibrosis. Audrey, a spirited girl who is still learning what CF is. And her sister Charlotte, who was born and diagnosed in December of 2011. Not only are the patients of CF important, but the parents who sacrifice much of their life and have their own stories to tell. You'll hear from my parents, Terry and Kay Coker, who are two heroes of my sister and I. My parents have become wise beyond their years. Then are Tim and Sarah Jane Jury, a young married couple still learning the ups and downs of what life is like with children with cystic fibrosis. There is Dr. Thomas Firkel, a professor of pediatrics and doctor at St. Louis Children's Hospital, who has devoted his whole study to make sure children with CF have the best care possible. This is a documentary for those who experience the disease every day and to tell the world the stories of these lives. Living with CF is not a bad thing, it's just not a good thing. I'm Tim Coker, and I'm drowning on the inside.
Cystic fibrosis, a disease similar to asthma, but with much worse symptoms.
Cystic fibrosis is a disease that affects the lungs and digestive system of many people in the U.S.
Cystic fibrosis is a genetic condition. It is caused by abnormalities, defects, if you will, in a chloride channel that sits on the top of most epithelial cells. And in the lung, that then results in chronic infection. The infection then incites a rather aggressive inflammatory response, and then the inflammation in the process of trying to clear the bacteria releases all kinds of noxious chemicals and irritants, which then lead to the airways to actually become destroyed over time.
From this comes many complications, including difficulty breathing, malnutrition, abnormally salty skin, and more. Until fairly recently, there were no adults with CF because they all died as children.
Currently in the United States, the average lifespan based on the Cystic Fibrosis Foundation patient registry is roughly about 38 years of age, which is considerably better than where it was when I first started doing this. I guess it was about 30 years ago when I was an undergrad working in a research laboratory. I think the average age of survival then was probably close to 18 to 20 years old.
This is shown in a quote from the Almanac of Children's Songs and Games from Switzerland. "Woe is the child who tastes salty from a kiss on the brow, for he is hexed and soon must die."
In the 1700s, 1800s, there was a German proverb that basically said that if you kissed a child and they tasted salty, they would not live very much longer. And it was probably the first description, although not tested, of the sweat test, which is what we use currently to make the diagnosis of cystic fibrosis.
It was in 1938 when CF was first diagnosed by Dr. Dorothy Anderson. After doing an autopsy on a young child, she noticed the child had a lesion in the pancreas. That lesion was characterized as cystic and fibrotic.
When she did autopsies on these children, she discovered that their pancreas was both cystic and fibrotic, which then led to the diagnosis, or led to the name cystic fibrosis of the pancreas, and of the pancreas was eventually dropped out.
In 1965, CF was known as a genetic disease. A genetic disease means that both parents have to be carriers of the disease, but not have the disease. If the man is the carrier and the woman is the carrier of cystic fibrosis, there's a 1 in 4 chance a child will have CF.
I think I really don't remember a time when I didn't know about the disease. I remember growing up in Houston, and they always had a CF telethon, and so I remember hearing about it. They There would be things in the newspapers about it, building up to the telethons. It was a big deal in Houston.
When I learned that she had cystic fibrosis, it was immediately after the surgery, with the surgeon telling us that due to his previous experiences, all the signs showed to him that she had cystic fibrosis.
The occurrences of CF patients being born varies all around the world. In the United States, a child being born with CF is a 1 in 2,000 chance. In the United Kingdom, a 1 in 2,500 chance. In Italy, a 1 in 15,000. And in China, the most populous country in the world, only approximately 1 in 100,000 chance of incidence, with only a 1 in 160 chance of a parent as a carrier.
When y'all were young, it was getting you through that year of school. Trying to get you to go longer without going in the hospital. Those were short-term goals.
Early on, one of our goals was to make sure that you stayed as healthy as long as you could possibly stay before you had a hospitalization. We felt like it was somehow that was in our control. If we could do everything right in your treatment, then that would give you a better condition with your lungs, so that when a cure would come, you would be in a good place to receive that medication.
And I take different medicines orally to help me breathe and also for my digestion and all that stuff.
On a daily basis, Kelsey has to take over 20 pills a day, as well as 5 aerosols while doing her therapy vest.
The vest is a inflatable vest that you put on yourself and then you hook up to tubes. Those tubes are then plugged into a machine device that sits on the floor or on a table, and then when you start it, it shakes you at different intervals and different times. So it helps you to break up the mucus that's in your lungs.
A patient with CF must do all these things on a regular basis to stay healthy, but sometimes the public knowledge of CF comes at a heavy price.
At church, they accept it. At school, you don't know whether they're going to accept it or they're going to judge you for it. And when I say judge, I mean like they either believe that you have it or they believe that you don't have it, and you're just being dramatic.
Not only is it difficult in the daily life of a patient, but for some, the hospital becomes their home away from home.
Life in the hospital, especially early, because at that time you had to stay the entire time that they were giving IV antibiotics, which was 10 to 14 days.
A life-changing experience would be the time when I was 13 and in a hospital for a month because I was very sick. And they didn't know. It took 7 doctors that one time to even figure out what was wrong with me.
But then when she was about 4 or 5, they started giving her PICC lines and we could bring her home, but you still had to go in for 2 or 3 days. But that was nothing compared to staying for 10 or 14. So it was still stressful, and it still is to go into the hospital. It's still stressful.
Finally, the last one, by sheer luck, even found what was wrong with me. Because I had been on steroids for 8 years of my life. And they found out that those steroids were covering what was happening really in my lungs. And it was like disguising it. So they took me off of my steroids. And then they found out by doing a bronchoscope what was going on in my lungs. And then by that, I eventually started getting better. But that was a life experience in and of itself. Because that was it's like the one time that I can remember feeling the way that I felt. And that was kind of a scary time. But in another way, it was kind of peaceful. So it was scary and peaceful. And I don't really know how to explain it other than that.
There were other moments of quietness and during the stay where it would be just the 2 of us in the room, late in the day, early night. Everything had calmed down, settled down. I remember snowfalls, and nurses coming in talking about how hard it was to get to work. You know, we were inside. We never had a clue what was going on outside.
I had a peace within me, which really drew me closer to God after the fact, and even during the fact, but after the fact especially. Because that's really when I started growing closer to God, was after that experience.
I do remember a few years ago on a Super Bowl Sunday, Boomer Esiason was featured during the afternoon on TV, and a story was given about his son who has cystic fibrosis. And during that program, they mentioned but they did mention the life expectancy. And I think you had an understanding, but I didn't think Kelsey quite knew about that. And I remembered one of you looked at me and said, "Is that true?" And I said, "Yes." And I think it was the first time that it actually dawned on either one of you that this was in a sense, a terminal disease. And I knew for Kelsey that was going to be something, and we knew it was something that she had to work through, and she worked through it spiritually. She began to put things together from God's sovereignty in her life, and that her having cystic fibrosis was a part of His plan for her life, and she accepted that. And instead of turning into depression, anger, and bitterness, she chose to look at this as a blessing that could be used. Oh, there's been moments of depressed moments, but she has, with great strength, looked towards the future and at the moment.
I think I look for encouragement or look up to my parents the most, definitely, because they're the ones that raised me and by their godly raising, I was able to see why I had this disease and how to live with this disease in a way that isn't a burden, and that they are the ones that showed me that I had a purpose in it by raising me in a godly home, and by raising me to look to Jesus for help, in that He is the one that gave me this disease for a reason. Like when I was little, I always used to ask Mom why I had this disease, and she always told me that she didn't know, but that God gave me it for a reason.
The things that we started with and the knowledge that was spoken to us in the very first days was all negative. We were told that, Kelsey, to get over our emotional problem of grieving about CF, we would have to get over that because we were going to have to learn how to take care of a child who was not going to be with us at the age of 5 or 6. That's what we heard immediately. That's not being told parents today. Parents are, I think, being comforted with that there are several things that you can do at home.
Yeah, lots of hope.
Lots of hope.
I mean,
now.
lots of hope,
Lots of hope.
can go out to young parents now. Yeah. I mean, there's lots of hope. And then I would probably say to them to just enjoy today. Just love today. And as hard as it is not to do, just try not to project into the future. Mm-hmm. Just enjoy today, enjoy the week, enjoy your kids now. And don't get too bound up in wondering what it's going to be like in 10 years or 15 years, just because none of us knows that anyway. I don't know it for myself, and I surely don't know it for you. So just enjoy now.
Ella Drury, a 4-year-old girl always trying to be as active as possible, bouncing on her ball, playing with her dolls, cheerleading. And she does all this with cystic fibrosis.
Pediatrician called and it was later at night. It was about 7 o'clock that evening. I was just chit-chatting with her, and then all of a sudden it hit me, why is the pediatrician calling this late? And then I realized it can't be good. And she confirmed that Ella did have CF, and I just started to cry.
My first reaction, I heard from Sarah Jane, and I was working, and she said, you need to come home. And so I pulled in the driveway, and she came out the back steps, and she came running out, and she was just sobbing uncontrollably. And I finally heard her say, Ella has cystic fibrosis. And I just remember thinking, oh my goodness, my daughter's going to die.
Ella also has a sister. In December of 2011, Charlotte Jory was born. Just a couple of days later, she also was diagnosed with cystic fibrosis.
I kind of felt like through the whole pregnancy she was going to have cystic fibrosis. That was my hope, that because I don't know how to raise a normal kid. And when we got the news, there was a moment of sadness, and still, I mean, it was about a day or so. I mean, it was kind of, because you almost have to mourn the fact that this is a huge life change. And you have to, there's a little bit of a grieving, or at least there was for me. But on the same token, it was like, oh, well, life goes on, and we've already been living this life.
Charlotte is as healthy as she will ever be, as CF is a progressive disease on the lungs and the body.
A baby with cystic fibrosis is born with perfectly normal lungs. They're not infected, they're not obstructed, they don't have all kinds of mucus that's interfering with their lung function or the child's function for that matter. But cystic fibrosis is a progressive disease, that while your lungs, when they start out, are perfectly normal, that over time they become infected and then therefore become inflamed. And that this combination of infection and inflammation in a child's lung results in the damage and the injury to the airway over time.
Babies also have to do chest therapy. Using little cups, the baby is popped on the chest to loosen the mucus. It used to be in the past that adults were popped for the same reason. Now Ella is old enough to do the therapy vest like Kelsey.
When they're well, we do their chest therapy, airway clearance twice a day. When they're sick or having a cough, not feeling well, we do it about 4 times a day. It takes about half an hour each time that we do it. So we usually, because a lot of times it does kind of relax Ella, we do it before her nap and then do it again at bedtime. When she's sick, we would usually start the morning off right after breakfast with another round of her chest therapy.
What is that, sis?
It's for my arm so that it can't hurt.
So it can't hurt?
No.
Oh. Are they putting medicine in there?
Yeah, a little bit.
Hospitalizations can come at a young age because it is difficult for CF patients to recover from infections. Even the common cold can be difficult to overcome.
I was at work, and I remember, because we went to a doctor's, first time Ella was hospitalized.
Yeah.
I was at work. Sarah Jane took her for a routine checkup at the clinic, and the doctor saw something and wanted to keep her, and was hospitalized. So Sarah Jane calls me and said, I need you to leave work right now, and I need you to pack a bag and come to the hospital, and gave me a whole laundry list of stuff. She's great at telling me exactly what I need and how I need to get it there. And
we're constantly monitoring their health, and when things begin to sound different, when things begin to, cough begins to increase, we call, they kind of monitor the situation. She was supposed to go in for a regular visit anyway, and so when she did go in, they heard that there was fluid on the lungs.
But for me, when I heard that, I was like, it was the reality of my daughter could be dying. Because she hadn't been really sick in 3.5 years.
Yeah.
She was, she'd get a little sinus infection or something like that, but she wasn't sick. And so we were in the hospital. But that whole process was actually a great process of being in there. They took care of her incredibly well. They took care of you. Mm-hmm. They made sure that she had the toys she needed to play in the hospital. They made sure she was comfortable. Ella, what are you doing?
Painting.
You're painting? What are you painting, baby?
A heart.
A heart? What color are you painting the heart?
Purple and red.
Purple and red? Who's the heart for?
For me.
It's for you?
Yeah.
Oh, yeah?
I get to keep it.
Yeah. Well, she's handled it great because she didn't, partially because I think our attitudes, there is not another option. There's not another option for her to do anything else, to know anything else. And so she really has adapted to life, and this is a part of her life.
For some, having a child with a terminal disease can bring further joy in parenting.
Tragedy has been a part of my life since I've been little. Losing my dad to cancer at 11, and seeing other loved ones pass away, things like that, and but also watching God's hand at work, and then seeing the fact too that, oh, both my girls now have cystic fibrosis. This could be, while it is very challenging, I think it's helped me be more compassionate and understanding of other people with illnesses. It's helped me be incredibly strong in the sense that as a daddy, you have to be the shade tree. As a husband, you have to be the shade tree and protector for your family. I remember when Ella was in the hospital, and just you don't get any sleep when you're the attending parent, but somebody has to be strong. And for this, it has made me even more of a man because I'm strong now, and my family can lean on me in emotional hard times.
The young and the old will have this disease forever in their lives. But for the parents, there is always someone to lean on.
One of the verses that I've learned very quickly and related to this practical application was Jesus said, "Do not worry about tomorrow, for each day has enough trouble of its own." Mm. And so it was, just focus in on what you have right now, today.
Yeah.
And don't worry about tomorrow.
Yeah.
Tomorrow's going to be another adventure. So each day, taking things in stride, step by step.
Yeah. Just do today.
Do today.
Do today. I think I would probably add, if I could say, because I've even, I think, asked myself this, would I change anything?
As far back as I can remember, my odds haven't been good. They did their best to let me have a normal childhood. Between the treatments and the checkups and the countless sleepless nights spent on my knees asking God, how can this be right? Why am I not among those blessed, those with health and rest for all their lives, standing by as my world falls around me? There is nothing that I can do or say, and I wonder why when I see these broken hands that you've given me, what good could ever come from my frailty? So Lord, even though that I am weak, would you help me find my strength? Years have come and years have gone, and so far I've done fine. But that little girl in the hospital bed has more things on her mind. Will I ever get the chance to be a mother or a wife? God, I need to know you've given me a purpose for my life. Why am I not among those blessed, those with health and rest for all their lives, just standing What good has ever come from my frailty? So Lord, since I know that I am weak, I need you to be my strength.
Perseverance, love, determination, and hope. All words that apply to cystic fibrosis. One day, they will not be this disease, but for now, they will take their pills, do their treatments, they will sing and dance, work and rest. They will live.
For so long I've been anxious that you'd make your purpose known, but now I see that in my weakness it's your power that is shown. Father, fill me with your love, and there I will abide. And so now, instead of wondering why, I know I am among those blessed, those who hope for rest beyond this life. And when the strife of this world weighs upon me, I have joy in the glory of your cross. And Lord, I try to use these broken hands that you've given me, but only you could show power through my frailty. Lord, only you can show power through my frailty. So Lord, I see you chose to make me weak so that you could be my strength. Yes, Lord, I see you chose to make me weak so that